in Main Street. As we approach a pivotal election, this is a crucial time for women's health care, the rights of pregnant women, and access to life-saving measures. Today's discussion takes on a new urgency as we address the racial disparities in both birth outcomes and the vital role of doulas and midwives in bridging health equities. Today, we recognize that this may be a difficult conversation for some, and we encourage you to take any steps needed to care for yourself as we explore these issues. Together, we aim to humanize the lived experiences of women in frontline communities, reaffirming that health is a human right and that polluters must be held accountable for the damage to our environment and our health. Our esteemed speakers today include, as always, Dr. Patricia DeMarco, author, educator, activist, and principal associate at Main Street Associates. We also have Yasmin Bennett Kelly, who is the Birth Initiative Director at Healthy Start, Inc., where she advances maternal and child health programs across Allegheny and Westmoreland counties. We also have Tiffany Belfield Elamin, who is the owner of Ballou Estates and a holistic full-spectrum doula. She is also a third-generation farmer. Tiffany uses her land for postpartum recovery, women's circles. I can't talk today, everybody. And to support mothers, including those without a home, and having safe home births. I am also honored to have one of Black's own speaking today, Kadeska Bray, who is the campaigns manager at Black. And Kadesh will bring in a cultural perspective on midwifery and healthcare. Again, I want to thank you for joining us in this essential conversation, as together we advocate for a healthier, more just future for mothers, children, and communities. And because we have so much to cover today, I'd like to just take this time now to hand it over to Dr. Patricia DeMarco. And again, welcome everyone. Thank you.
Thank you, Archbishop Dinkins. It's a pleasure to be here with you on this session dealing with healthy mothers and children in a healthy world. I would like very much to talk about a summary of the pollution effects during pregnancy and recognize that women are more vulnerable to pollution during pregnancy. And the timing of exposure to pollutants matters for the development of an infant. And people who have chronic exposure to pollution are more vulnerable than people who might just have an acute, occasional exposure. And we need to look at the things we can control, such as interior spaces and nutrition, but we also have to look at what we must act to change. So I'm looking at a quick review of the fact that you can ingest or inhale or have contact with pollutants that can affect how chemicals get into your body. And of course, if they are affecting your body, they're also affecting the developing infant. And the physical conditions, especially those caused by climate change, can exacerbate these kinds of stressors. And we look at the fact that we have a large number of chemicals that we're exposed to, and 76 of them cause cancer, and 79 are known to cause birth defects or abnormal development. So we know that there are chemicals in our environment that are exposing sensitive people, especially mothers and children. Next, please. So we've talked a lot about the health harms associated with petrochemicals. A lot of them have adverse birth outcomes like preterm birth, low birth weight, miscarriages, stillbirth, and birth defects. And also many of them are endocrine disruptors, which affect the hormones and the endocrine system. And you can see that some chronic conditions, like the green line shows preterm delivery, and then higher blood pressure on the orange line. Those have been fairly constant over the decades, but early birth defects and low birth weight has been increasing over the last 20 years. And that to me is an alarming number, because that's one of the things most closely associated with chemical exposures. Next slide. And it is shocking to find that America has an average of all maternal deaths, 23.8 per 100,000 live births. We are 45th among developed nations in our level of maternal outcomes, and mortality rates among maternal mortality rates in the United States increased 78% between 2000 and 2020, while dropping in most other countries. So we have seen an increase in maternal adverse health outcomes compared to other countries. And we're also the only higher income country that does not guarantee or provide free health care. And there are strict correlations between the availability and affordability of healthcare and maternal health outcomes. Next slide, please. So compared to white women, American Indian and Alaska Native women and Black women have over 3 times higher the rate of pregnancy-related mortality. They have higher shares of preterm birth, higher low birth weight births, and births for which they receive late or no prenatal care. And as a result, we also have higher infant mortality rates. And the causes of these kinds of poor maternal health outcomes have been studied as well. And there's a rising trend in pregnancy-related deaths over the last 2 decades. Many of these are psychological effects of chronic stress from racism in Black and minority communities, which lead to the deterioration of a person's health, which adds about 10 years to their life equivalent. And there's an implicit bias of healthcare providers, which has been detected, where doctors ignored symptoms or requests for help that they received from Black women. And there's a chronic health condition underlying, especially heart disease and hypertension, that may be untreated or undertreated because of poor access to healthcare. And then there is the domestic violence, suicide, and especially in the postpartum period when women often need emotional support. The most shocking thing that I found in this National Institute of Health Sciences study is that 83% of maternal pregnancy-related deaths are preventable. Next slide. And we find that in particular studies where they looked at populations that were particularly exposed to chemicals, they found that the rate of experience of higher rates of preterm birth and fetal growth restriction was higher relative to other populations. Black women were disproportionately exposed to environmental hazards, and prenatal exposure to multiple classes of chemicals was associated most strongly with reduced birth weight. And that adverse birth outcomes were greatest in magnitude for women who had exposures to combined tobacco, insecticides, polybrominated diphenyl ethers, and phthalates. Those last 2 are things that are petrochemical compounds often found in personal care and home care products. Next slide, please. There was a large study done in New York of 65,270 pregnancies and birth outcomes that were tied to environmental justice indices. And they found that adverse pregnancy outcomes occurred in about 38% of the pregnancies, and that the environmental justice index score, as well as individual adverse pregnancy outcome conditions, were observed for stillbirth and hypertensive disorders of pregnancy. And race and ethnicity was also tied to in the environmental justice index and birth outcomes. And you can see that the higher the exposure to chemicals, the higher the rate of adverse pregnancy outcomes occurred. Next slide, please. There also were significant racism and discrimination factors in the care of women, especially differences in insurance coverage. If you had no insurance or public insurance, you had a higher rate of adverse health outcomes than if you had private insurance, and that access to postpartum and infant care and access to prenatal care and nutrition was highly tied to these adverse outcomes. Social and economic disparities and discrimination from caregivers were also significant factors in adverse pregnancy outcomes. Next term. Excellent. So what we need to look at is try to encourage ways to have healthy mothers and children. You need to look at whole communities. You need to focus on community support for mothers and infants, especially things like prenatal care and providing access to nutrition, well baby care, and paid leave for maternity, significant enough in length. 3 days doesn't do it. I don't know if any of you know how you felt 3 days after giving birth. I certainly wasn't ready to go back to work. We need to promote safe communities that have clean air and water and access to healthy food choices, access to transportation and to childcare. And we need to support breastfeeding, both with postpartum home visits and lactation facilities in work and community locations. And we need to support collection and monitoring of accurate health outcomes. These things are complex and interrelated factors that require attention from all of us as we look forward to having healthy children in a healthy world. They're connected, they're related, and they require attention from all of us. I've provided a number of resources where you can look at some of these studies in more detail, and they will be provided in the resources that are shared after this session. And it's important to remember that nature is our helper, and providing natural environments, especially for mothers and children, and especially for young children. I'll close with one of my favorite quotes from Rachel Carson that says, "In nature, nothing exists alone. Those who contemplate the beauty of the earth will find reserves of strength that will endure as long as life lasts." And I take hope from that myself, and I hope that this is helpful. Thank you very much.
Our next speaker is Yasmin Bennett. Yasmin, we welcome you to the floor.
Thank you. Good afternoon, everyone. My name is Yasmin Bennett Kelly. I'm the director of the Birth Initiative in Allegheny County in Pittsburgh, Pennsylvania. I'm a mom, I'm a sister, I'm a friend, I'm a partner, I'm an educator. And over the past 2 years, I've been charged with leading this initiative to reduce infant and maternal mortality in Allegheny County. BIRTH is an acronym that stands for Battling Inequities and Realizing Transformational Health Outcomes. So I just wanted to make sure that you know that. And in just one moment, I will share my screen. Right. So the title of my presentation is Centering Black Mothers, Birthing People, Babies, and Families. Healthy Start, established in 1991, so we are about 33 years old at this time. Our mission is to improve maternal and child health and to reduce poor birth outcomes and infant mortality in Allegheny County. We believe in healthy communities, healthy families, healthy babies, Healthy Start. If you are familiar at all with the federal funded program, Healthy Start, then you are familiar with our home visiting program. However, Healthy Start Pittsburgh has expanded so much since we started out 33 years ago. And we now have a doula program. We have a Center for Urban Breastfeeding department, which is where we fulfill all of our services regarding lactation support. We have a fatherhood program that is support of fathers and parental figures. And we also have a research department in addition to many other services and community education that we provide. And so, in support of our mission, Healthy Start is committed to applying a racial equity lens to address disparities in maternal and child health outcomes that are experienced by Black families in Allegheny County. According to Race Forward, a social justice organization that works across communities most affected by systemic racism to build collective power for racial equity is a process of eliminating racial disparities and improving outcomes for everyone. It is the intentional and continual practice of changing policies, practices, systems, and structures by prioritizing measurable change in the lives of people of color. And so this is my passion. This is not just scholarship for me, but it's something that I'm very passionate about, especially as a Black woman and a Black mother. My goal and my dream is for all mothers to be able to have birth outcomes and experiences that they can be proud of and that they can be happy to share. And so if I could, I will just start with a short story about my own birthing experience that I realized is very unique for Black women. So I had my child 2 years ago at the Midwife Center here in Pittsburgh, the first freestanding birthing center in Pennsylvania. And I was able to have the birthing experience of my dreams. I was respected, I was acknowledged, I didn't have any issues advocating for myself. I was able to have a safe, healthy water birth and deliver a beautiful, healthy baby girl. And so after having my child, I really reflected on my experience, and I reflected on the anxiety I experienced leading up to having my child. And I know that I was hearing so many statistics about Black women and infant mortality, maternal mortality, and it was truly terrifying. And so something that I am really committed to and passionate about is just ensuring that Black women and women in our region get to have experiences of their choice, whether it is a natural birth, whether it is a hospital birth, whether you want a medication-free birth, or however you desire. I believe that all women should have the choice. All women and birthing people should have the choice of how that goes. And so locally, the data directs us to focus on outcomes and disparities experienced by Black women and babies. And so here's the state of Black maternal and infant health in Allegheny County. The infant mortality rate among Black infants is more than 4 times higher than that among white infants. The maternal mortality rate for Black mothers is higher in Pittsburgh than in 97% of similar cities. And lastly, Black women and birthing people in Allegheny County have nearly twice the proportion of preterm births and over twice the proportion of low birth weight babies compared to white women and birthing people. And so my presentation is not to reiterate or drill any of these statistics into your mind, because I'm sure many of you are familiar with them. We know what the state of maternal and child health is in our country, especially regarding Black parents and birthing people. And so today what I'm going to share with you is a community-led response to reducing infant and maternal mortality. So 3 agreements that I have are to stay engaged, to experience discomfort, and to expect and accept non-closure. I can tell you, at least for my presentation, that we won't walk away knowing how to reduce or eliminate infant and maternal mortality. We won't have the magic wand that will get rid of all of the inequities that we're all facing today. However, we will have some ideas from the community on how to respond to their needs. And so here is the web of causation, and I do have my sources at the bottom and at the end of my presentation for you to review. But we recognize that racism is a determinant of health and not race. And so we really like to stay away from the language that deems race as a factor when really it's racism. And so I just like to give you a minute to see how all of these things, slavery, Jim Crow, food stability, food accessibility, safety, education, income, and then we take you back into history with the GI Bill and redlining, the 13th Amendment. All of these things contribute to the increased maternal and infant mortality. And while some of these things seem so far away from us, the fact is that they're still impacting families today. So the birth plan, which is what guides my work, is a guidebook. It's a blueprint for eliminating and reducing poor birth outcomes in infant and maternal mortality. And so this was created because community came together. We sought and incorporated their input at multiple stages. And so we had research projects, we had town hall events, we did surveys, we had public input sessions. And this was a result of seeing multiple reports and just witnessing many occurrences of Black women and birthing people having hardships, having tragedies, being neglected, and all of these things. We're reading the reports, we're seeing all the data, but we're not hearing from the people. And we know that the numbers represent real people, real lives, and real experiences. And so that's why it was so important for us to get together with the community, those who do have the lived experience, and come up with a plan together. And so that plan is the birth plan. And here are some of those key themes from the community. More maternal and child health workers that are Black and are from their communities, more greater compassion, cultural humility, and a warmer bedside manner from maternal and child health workers, more accessible mental health support, paid leave for all parents, greater access to nutritious food, and more accessible and affordable childcare options. These are the themes, these are the ideas that the community came and shared with us. And so with all that they shared, we created 4 action areas in response to their needs. The first is strengthening the MCH workforce. So a lot of our work at Healthy Start is focused on strengthening doulas, lactation support, childbirth educators, community health workers, midwives, mental health professionals, nurses, physician assistants, physicians, and other workers that support the health and well-being of families. We're also focused on strengthening systems of care. So maternal and child health systems of care include the healthcare system, public health system, social services, family support services, and other community supports that aid birthing families and families with children. And so what that looks like is really bridging the gap between community and healthcare. Another focus that we have is addressing social determinants of health. And so this area is focused on addressing social determinants of health, such as the conditions in which people are born, grow, work, live, and age. And so we have partnerships with WIC at the state level, at the local level, to really ensure that we're making sure that all of our families have access to nourishing meals and nourishing food around them and in their community. And lastly, coordinate and streamline maternal and child health activities. So we know that there are a lot of different initiatives, there are a lot of different organizations who are doing this work and driving these efforts. And so it's really important that we streamline the work, we reduce duplication, and we figure out a way to maximize our resources in a collaborative way. And so here are the 6 conditions of systems change: policies, practices, resource flows, relationships and connections, power dynamics, and mental models. These are the things that must occur in order for us to achieve systems change. And so here are many of the partners that we work with in the Birth Initiative. We have the Health Department, Gateway Health, the Midwife Center, UPMC Magee, Magee Women's Research Institute, the University of Pittsburgh, Trying Together, the Department of Human Services, and many other partners. And I show this to just say that this is not work that can be done by working in a silo, but we must work together and we must be collaborative. And so some of our partners are community-based, but we also work with health plans. We also work with hospital systems, and we collaborate even with similar organizations. And so within the first 3 years of this project, we worked with 3 different specific partners. So Pittsburgh Business Group on Health is one of our more corporate partners, a different type of partner that we've been working with. And so we work with this partner to really get a landscape analysis of the workplace policies in our region. So we would like to know, where are birthing people being employed? So that includes women and birthing people who are of a certain age to have children. So we want to know, where are they working? We want to know what the policies are. We want to know if they have flexible work policies, if these employers are providing paid leave, what their leave policies look like, and all of those different things. We also are working with Trying Together, which is a leading organization advocating for quality and accessible childcare. And so we have partnered with Trying Together to allow several women to be able to have their own home-based childcare program. And so they receive grants, everything is free, they don't have to pay for anything, and they receive a mentor, and they're able to get that mentorship while starting their own home-based childcare program. And then lastly, we have DAWA, which is a nutrition and wellness program that teaches women, birthing people, and any maternal maternal and child health worker in our region how to nourish their body through medicine. We know that a lot of the information that is shared oftentimes can be very harmful, and we know that nutrition, especially for those who are having a child, is very important. And so that is a space for community members, for doulas, for birth workers to come and to learn about how they can support their birthing person while they're pregnant through nutrition. And so our vision is maternal and infant vitality in the Black community. So we hope to see food security. We want people to be able to have access to nourishing food within their own neighborhood. We want affordable and accessible childcare. We want affordable and accessible transportation. We know that many parents, especially birthing people, are missing their first postpartum appointment. That appointment is very crucial. It's very important that they make that appointment because we know that many of the pregnancy-related deaths occur within the postpartum period. And so reliable transportation is a priority, as well as parent-supportive workplace policies and environments. Many parents in this society today are working parents. How can you be the best parent that you can be if you are employed by an employer that does not support you as a parent and someone with a family? So how many employers realized after COVID, after the pandemic, that they actually could have a flexible workplace for parents, for families, for people who are caregivers? Next, anti-racist healthcare providers. It's not enough to say that you're not racist, but we need providers that are anti-racist and that are committed to evaluating their biases, because we all have them. So we want folks that are committed to having those conversations, receiving those trainings, and also there needs to be some follow-up. And so we know our partners at Allegheny Health Network within First Steps and Beyond, they have trained hundreds of providers over the past couple of years, and there's been a lot of great feedback. And so we really just need more of that. We need more trainings, we need more follow-up, and we need more candid conversations. And last, livable wages. A lot of people will say that money can't buy happiness, which I agree, it can't buy happiness, but it sure can help the health and the well-being of a family. And so we know that if families have a livable wage, their outcomes can be better. We know that socioeconomic status does not necessarily eliminate issues with prenatal and postpartum care, but we know that being in a better economic place can support you. And so this is really what this plan is all about. And this is why we are here to do this work, because we don't only want to eliminate maternal and infant mortality, but we really want babies to have that day 366. We want them to have their first birthday, and we want to invest in the vitality and the resilience of these families. And so here are my references. I feel like I kind of sped through that, but if there are any questions, I hope that we'll have time for questions at the end at some point. But I thank you for engaging. I see there are some comments in the chat, and I will share my email in the chat as well if anyone would like to connect additionally. Thank you so much.
Thank you, Yasmin Bennett Kelly. And I have to say your whole name, okay? And for those of you who missed the introduction, Yasmin Bennett Kelly is the Birth Initiative Director at Healthy Start, Inc., and who is advancing maternal and child health programs across Allegheny and Westmoreland counties. I want to thank you for such a powerful presentation, and the reminder that we cannot do this alone, that it's going to take all of us, and that this is a collaborative effort. Hopefully we will have an opportunity to have questions and answers. And if not, again, she will be placing her email in the chat, and we will also be sending out, Yasmin's information as well after this webinar. It is my honor to also reintroduce Tiffany Belfield Elamine. She is the owner of Ballou Estates and a holistic full spectrum doula. She is also a third-generation farmer. Tiffany uses her land for postpartum recovery, women's circles, and to support mothers, including those without a home, in having safe home births by providing them a home. Welcome, Tiffany. So glad to have you here with us.
Hello, how are you all? I just want to say shout out to the work that's happening in Pittsburgh. Like, that gave me so much motivation to go harder. Sorry, my voice is crackly today. The weather is definitely changing here. but I'm just glad to be a part of all. So I'm going to attempt to share my screen. I just have a couple of slides. I'm very much on evidence based, and I love to show the work that we're doing. Not just I don't want to just talk about it. I don't want to just be shooting out this information because it is literally it's my baby. So we're gonna try this and see if it works. Let's see here. Can you guys see my screen? You see that bright pink and purple? Anybody say
We
yes?
can't see it yet.
You cannot see it?
No.
No.
Okay. Well, okay, let's see. Okay, well, I think it's just gonna be yeah, we'll
You
just
wanna
turn this.
quickly
It's okay.
email
I'm
them?
gonna
Yeah.
send it into the chat.
Okay.
And
can.
you guys are more than welcome to look through it on your own. And look at the pretty pictures, and I'll talk through it if that's okay. As I don't want to
Tiffany,
waste any time.
I can go ahead and pull up your slides for everyone if that works for you, and I can just click through them. I'm requesting access right now,
Yes, that would be great.
for sure.
I had a share. Here we go. All right, I just sent that to you.
Okay. Great, I'll have these up in just a sec.
Awesome. Well, while all that's going on, I'll formally introduce myself. I'm Tiffany Belfield Elamine. I have been a full spectrum doula, for about 20 years. My daughter is 19, and my goddaughter was one of my first experiences. And when I knew I wanted to be into birth work, she is now 23, and then my baby is 19. And so the biggest thing with the work that I did was there wasn't doula certifications. There weren't a need for doula. I had my daughter. I was a single parent. I lived in HUD housing. I didn't have a lot of guidance. I didn't have a lot of support postpartum. Um, and there was just a lot that I didn't realize I didn't have until I'm in a community of other women who are birthing, trying to breastfeed, who don't have mothers, fathers, do not have support systems, do not have anyone to advocate for them in the hospital. And it became this thing where everybody was like, hey, I'm about to have a baby. I need you to be there. And so I just continued to look around and realize I'm in Kentucky. I live near East Kentucky in Madison County, rural. And there's not a lot of people who look like me. So representation and intentionality of care was a big thing for me. Like you can't put everybody in a box, right? Culturally, East Kentucky folk are different from Louisville, and the Black folks in those regions are different. We talk differently, we move differently, we have different religion backgrounds, spirituality practices. And it really pushed for me to just always make sure that a woman had somebody who looked like them to speak on their behalf and speak with their consent if they don't know how to speak. White coat syndrome is real. And it was just a lot, it was a lot that I was seeing year after year. And just like healthcare, things change, the bills change, the policies change, the providers change, the insurance changes. And there's a lot that if you're not in the know, especially in Kentucky, you don't know. And people were losing out on resources. They were starving. They were getting kicked out of their homes. I've literally helped women get placed into home care because they don't know where to go to, and then maybe walking into an office where, like the other woman said, it's not race, it's racism. It's systemic racism. When you walk in, they're already reading you, and they get to perceive what kind of resource they want to give out, which is completely unfair and so biased. So that was like just a spill on like how powerful and how like passionate I am about this, because it's not like I didn't live the experience, right? And I use my experience and evidence to move forward on how I'm champion for women, no matter what their demographics, no matter what their support system looks like. So the Floating Lotus Doula Service, this is an initiative came out of Blue Estates. Blue Estates is my LLC. It is my land. It is my farm. We do a lot of rematriarchal work here. I have a women's retreat every year. And the more that I was doing women's retreat, as I was going through domestic violence, I realized that it is much more than birth work. It's women's work. And women go through a lot because of emotional and trauma, not necessarily just because of their health disparities, right? So the Floating Lotus Doula Services, it breath life in 2019. And it, like I said, it was a one-man show. I was just me. In my first 2 years, I had birthed over 50 babies, been a part of a birth, help with unassisted birth, been in home birthing, meeting new doulas, meeting folks. There wasn't a lot of people who looked like me. There was no certifications. I didn't even know about DONA yet, right? Everybody's like DONA. But as I went through certifications, and we can go to the next slide. As I went through the certifications and everything, I realized that, yeah, I could take stillbirth A and DONA and all this stuff, but who is telling the story of the Black woman who didn't have a dad and lived with their grandparents and food stamps and dealing with school, like just a whole lot of, like, there's a narrative that was missing from these doula certifications. I took the classes so I could be certified as COVID hit and everybody had to have a piece of paper. But the work that was already being done was just being supportive, helping moms, just being present, because even if the father was there or the mother was there, there's always somebody putting some type of negative into their ear, even if it's just a look when you're going into a hospital, a doctor's office where it's completely white. And even for some of my East Kentucky white clients, East Kentucky gets marked off because they think that we're all ignorant, and don't know how to take care of ourselves without even getting to know a person, just what is on a piece of paper. So I had to wear a lot of hats. I'm Afro-Laptian, East Kentucky. I was born a single, and I wear all my hats so they know that I can relate. We need relatable resources and not just things that just look pretty in a grant so you can get your demographics. Like, I really get to know these women, and goes into my mission statement. Um, we are full spectrum is not just full spectrum. To me, is holistic. I'm part of a team. But if you're going to do the medical things and make sure that their labs are done and their ultrasounds are completed and all the measurements are done, then I'm going to make sure that I'm tapping into her mind, her body, and her soul. How do you feel? Why do you feel this way? Okay, we went to the doctor's office together and I'm looking at you. She can't see that you're shutting down. We don't have to talk about that right now, but we're going to talk about it when we leave. But the thing is that they need to know as well. It may mean that you need medicine. It may mean that you need therapy. But if you feel comfortable talking to me, let's do this together. And I make sure I go into doctor's visits. I go to at least one ultrasound, because there's things that together as a full spectrum birth team, we can actually make sure that those numbers, those data, the information that the doctor was putting on at the beginning, we're trying to change that statistic. And they don't got time to do that, right? They got 100 clients. You go to a labor delivery hall, they don't know you except from the moment you walk in there. They haven't talked to that doctor's office. They don't know what you're going through. And that's what my job is as a doula, right? Next slide, please. That looks blank. Pictures. So this is what it looks like for me, right? This is my world. Home births, preparing for home births, catching placentas, walking around with all the bags so the dad can literally hold that mama's hand and just walk in there without worrying about carrying all the luggage, right? The middle picture is a blessing waste ceremony. Like I said, mind, body, soul. There's so much trauma that women go through from age, you never know. A sexual assault, sexual abuse happens a lot in the backwoods countries, a lot in heavy populated cities, urban areas, a lot in people of color. And that trauma, they don't get time to navigate that. And my goal is to make sure that this baby comes earthside with the least amount of trauma. Statistics show that a baby can come through the womb already absorbing the trauma, emotional disparity, like, I'm sorry, not the word I wanted to use, trauma, emotional damage before it even takes its first breath outside the womb. My job is trying to eliminate that. We already have to deal with postpartum hormones. I would like to not have to have you have to go through so much if it's not necessary. And I've had clients come to me at 30 something weeks who have went through so much trauma in their doctor's offices, and they are being told that they can't do this and they can't do that. You can't leave practice. You're birthing a baby, and it is your personal woman's right to birth when and where you see fit. And the laws in Kentucky are crazy. We lobby a lot. We do a lot of work trying to make sure that folks understand that this is our right and not the rights of someone else who doesn't live in my body. Next slide, please. So the history, I won't go down it, but just to know, I got my associates in science. I'm a medical assistant. The transition for me going from doula to student midwife is, and I'll talk about a little bit more about it at the end, but I'm having doulas they've got their certifications, they've got their lactation certifications, they've got all these certifications, and they're like, all it is information. I don't know how to apply this information. I've never had to do half the stuff that they taught me. And I'm asking folks to help me, and nobody is wanting to help a doula. But doulas are very needed and necessary for holistic care. So the history of me switching into being a midwife is that I need doulas and the state needs doulas. And so as I built the Floating Lotus network, it was for me to create a village. And the village was created. And just for reference, it's like I've worked with a lot of different, orgs and hospitals and insurances, but there was not and is not up until Sister Song came into Kentucky. Shout out to Ananicia Williams for bringing Sister Song from Georgia up to Kentucky and spread our network as a state. But before then, there were no Black orgs, no Black nonprofits, no Black doulas leading the work. And I took that role very maternalistically. I didn't ask for it. Nobody gave it to me. I don't get paid to do most of the things I do. There's no grant. There's nobody paying me to do nothing. But it's like I'm watching my sisters, my aunts, my mothers. I'm watching these women struggle and wanting to find representation in their chiropractor care, in a trauma-based counselor, in an OBGYN, in a primary. I have young mothers right now, women who are mothers, women who are just women who have not had a baby yet, and they don't even know what a PCP is. They don't have primary doctor. And I realized like I have to build this village because even if I'm just doing birth work, I need women to be able to have somewhere else to go to make their mind, body, and soul complete. So they are prepared for birth. They are prepared for motherhood, because that is a gap. There's a huge gap here. So through the history, the village created. So now I have 2 Black chiropractors. I've got an all Black trauma-based counseling service that resides in Louisville but has an office in Lexington. And Black doesn't make it right. I just want to say that out loud too. Some of my village are just women who have experiences, who have enough common knowledge and common sense to understand that even if I don't look like you, I can refer or I can empathize. Empathy is something that has to be taught. People are not born with it. I promise you that. And through my work and working with certain people and organizations, I've been able to, for lack of better words, groom to say, I trust you and I need them to trust you. And so I vouch for them. And that's part of my village as well. So um, food access, food boxes, referrals, trying to get to the SNAP Ed office, learning how to walk through those paperwork, those stages, having people who are part of my doula students, walking them through so they don't feel like I'm being judged asking for supplementary care, right? Next slide. And sorry if I'm jumping over, guys. I feel like I'm like saying my biography more than like me telling my business. So this is what support looks like over the years. I've doulaed in the hospital. I've doulaed in a car. I've doulaed in many varieties of homes, including my own. I have doulaed on the land. Next slide. I have helped women through court. I've helped women through battles of paternity, helping them get legal services and care so they know how to really handle themselves without losing custody. Um, THC is a thing now. There are Canna moms who supplement through that for their own therapy or whatever have you, fighting court because they want to make them seem like they're an unfit mother. A lot of these people go in there emotional and they end up losing their kids for something that could have been very much so renegotiated if they had the education and the advocacy that they were deserving of. I've had to deal with the laws changing in Kentucky where we cannot abort. The mother on the right, she had a baby who had anencephaly. They found it at 22 weeks. They told her she couldn't abort it. They made her carry that baby to term. She has no mom, she has no dad, and she was not connected to the father of the kid. It was just me, her, and her other kids in there. She had to birth a child that stayed alive for 2 minutes. That is a trauma that's going to stay with her forever. Me being a doula, I don't stop at birth. Like I said, this is women's health. And the village supports her now to date, you know? Um, Next slide, please. I also doula in the C-section room. My mom wants to go VBAC. I try to go to those doctor's appointments as much as I can because they're going to tell you that you're too big, you're too this, you're too that. There's always these reasons to get them in the cesarean room. I tried to advocate for moms so they understand really what their rights are and what the paperwork they're signing instead of just doing what is traditional and what is routine. Because a lot of those things are not necessarily to protect you, but to advance their payments, to advance their statistics. And we need to meet in the middle because what's safe for you may not be what is best for mom. And that is evidence based that I've seen over 20 years of birthing in a variety of ways in a variety of places. And I've birthed outside of Kentucky as well. And it is a little different, but the health system is the health system and it needs to be in a box. The work that I do is it's not a one size fits all. And I try to mold each one's individual situation to the boxes of healthcare and um supplemental incentives and food access. And you go somewhere, next slide please. You go somewhere and then you get a box of food. Everybody's getting the same box. But when that box of food goes home, who's got the microwave? Who's got the pans? Who has the recipes? Who has the grandmother history to know how to make them sweet potatoes? Everybody's experiences is different. So yeah, the resource of obtaining food is everywhere. But what happens once the food leaves? No different than what happens when that mom leaves the hospital. Postpartum is not just making sure she can breastfeed. Can you come do latch checks? What about if this mom has an incision so big that she can't leave and there ain't nobody and she has no car? Is she supposed to get on the bus and come so you can do a latch check? No, I have my midwives, my doulas come in home and check those babies in home because that mother shouldn't be doing more than what is necessary. And that is also what increases the Black maternal death rate is the fact of them doing too much too soon because they do not have a support system or anybody to meet them where they're at for a variety of resources, but most importantly for their health care. Next slide, please. I just like to show pictures because I just love the work that I do. And these are some pictures of what does home birth look like, Lotus birthing. Culturally, I've had some folks from the continent, from the African diaspora, and it's like we are very much so into our herbs. We want to do things with our placentas. Women ask me all the time, why can't I have a Lotus birth in the hospital? Because they're freaked out. Not because you won't take care of your cord and not because you won't take care of your placenta, but they think that something bad's going to happen outside of all the diseases and infections that come from being inside the hospital. You think this is going to make it worse. And I have to advocate to be like, these are your options, right? But this is not the way that, it is in the hospital. And you have to be okay with that. But I get questioned more now than ever. What are you going to do with that placenta? So placenta care is a thing. Home birth in its own realm, I'm not going to let a mom go to home birth for just because she wants to. If I 20 years of experience working with 5 midwives across the state of Kentucky, if I feel like there's a problem, I'm going to refer you to a home birth midwife if you're not already covered by one. And if we decide that you should be in a hospital, you're going in a hospital. And we will advocate from there. I want you to be healthy, and healthy may not always be your plan. And that's why we have more than one plan when we're working through what's going to happen next, right? Next slide, please. Just one more beautiful pictures of birth. Next slide. family support is also a big part of this in the village. I have younger doulas that I have trained who will come in and do sibling care if we're in the home and if we're in the hospital. A lot of times birth happens no matter where you think you thought you was going to have it at. And I'm able to go to my phone tree list and say, hey, I got to meet this mama here. I need you to meet me here. I need you to take care of the kids. This is already set up because we've already talked about it. And I'm going to meet this mom at the hospital. Family support goes into crisis management, excuse me, because you just never know what's going to happen. I've had some dads crash out because what you're not going to do is talk to my wife like that. You're not going to talk to the mother of my kid like that. And the doctors don't have time to do that. The nurses, there's signs on every wall. If you talk too loud, you cuss too much, you're out of here. What does that mean? That then she's left with a whole care system that she just met that day. So it's my job as a doula, and I train my doulas not to get so deep, but deep enough where you could tell when things are going to get heated. And the irony in that is that out of all my clients, and I have maybe 75% Black, probably 10% white, and the rest are other, else immigrants, folks who do not have status, folks who do not fit just a Black and white box. Um, Totally different experience when you walk in and you're white. It just is. I've had to have one of my white doula advocates come in and sit because of the bias and even some of the comments that were made as I was trying to advocate for a mom who had a very different lifestyle. She was a street worker. But because of her lifestyle, does she not deserve to be treated like a middle class citizen, maybe someone of white color? What makes you the judge? And I have to teach my students, like, I know you're gonna feel a type of way, but her energy is gonna be based on your energy. And you have to make sure that you're advocating from a place of professionalism and you stand your ground even if she can't. But the village is made so if I have to call up backup, I'm gonna call up the appropriate backup because I already know who's gonna come in and change the shit, like shift the narrative and change the energy in the room. It's sad that we have to do it in 2024, but we still have to do it. Next slide, please. Part of the village is, what does postpartum look like? We offer yoga. We offer a lot of somatic energy, refocusing and moving trauma through your body that you might experience through birth. Things happen. I mean, I've seen the doctor jump on top of the mom and the baby was cockeyed the wrong way and she's pushing on. That's traumatic. I had a mom who the nurse misdosed and didn't take her off of her epidural when we're switching to get ready for C-section. And we almost lost her, and she's still going through trauma. I just referred her to a different counselor because she has nightmares of death to the point where she wakes up trembling. Almost didn't want to take care of her child because she thought that she was going to die holding her from this experience. Postpartum is more than, oh, you might have some sad days. Postpartum is literally your hormones reshuffling itself. And a lot of moms are not taught that. A lot of doctors don't tell their moms that. You know, a lot of doctors don't want to walk through it. It's just like, well, I hope you're okay. Come in and check on you next 2 weeks. Hope everything's okay. Let me know if you need some medicine. There's a piece there that I need to walk through this. I need to know exactly what should I be feeling? Why am I feeling this way? And a lot of times moms are nervous to talk because they don't want, we watch TikTok, social media is real, and it's like, well, that mom was unfit, so we called DCBS, we removed the kids from the home. I've had 2 clients that weren't my birth clients who called me and they were like, they told me I was mentally unstable and they're threatening me to take my child. Where were the steps in between there where she should have gotten the appropriate care? And I put her with a postpartum, one of them. The other one, it went full case. She actually ended up, I got to her too late. I had got the call. I tried to call her. I couldn't get a hold of her. Hadn't met her yet. She was still in a distrust. And she ended up killing her kids. She's now in jail. What were the steps that were missing? How did that happen? Is what I ask myself a lot. The other mom, she did get help. She's in therapy. She is in our mama hub. Our moms check on her. And my moms, did you hear what I'm saying? My moms check on her because that's how the village is now proportioned, is that the moms are just as much as an advocate now because they've now learned their rights and seen that, oh my God, I have a voice. Okay, girl, well, next time you want to get pregnant, holla at me because I understand you because I am you and I'm going to support you through whatever you need to be supported through. And she's doing great. And her kids are great. And she's got a new job. She's doing great. But there's a village that comes into that, and that is something that can't fit into a healthcare box. And even in Kentucky, they're trying to figure out how do we do state doulas so they can get, because Medicaid and all the insurances, and they want us to have the board of doulas and like a board of nursing, and makes it very medical. And it's like, yes, there is a medical component. I make sure all my doulas are trained with all neonatal resuscitation, CPR, all the things, but they aren't there. They're there for the therapeutic mind, body, soul component that's supposed to match your healthcare. And together, we're supposed to be doing this work. It cannot fit in a box. It's not like if you hit a certain number, then you can't be, or you know what I'm saying? It starts to get really flushed, and it can't be that way. It can complement it, but it can't be that way. Um, I even go to doctor's visits. One of those pictures is me going to a doctor visit. Dad had to go back to work. He had no daddy leave time. And so what happens? She can't carry that car seat to that baby's first appointment. Who's supposed to do that? Or is she supposed to strain herself out? Are they supposed to not get, their wages to take care of the month? She only got 2 weeks of postpartum. You know what I'm saying? So again, case by case, you never understand what people need unless you have somebody in there daily with them working through the things. And then I feel like this will be the last slide. No, these are just really cute postpartum pictures. Sorry. That you are more than see, just the variety of people. And we can go past the placenta care. Placenta care is a very spiritual thing. I had a mom we had to have a ceremony for her to give me the placenta so I could process it because of her attachment to it. And just imagine when you're in the hospital and they just throw it in a bucket and just throw it in a red bag and you don't know what God knows what you're going to do with that placenta. And that is literally what my egg and my partner's sperm created to keep my child alive for 9 months. It is a very, very big thing. At least 75% of my moms have a very big attachment to, but placenta care, that's some pictures of those things. And it needs to be more normalized in hospitals. Like now they got forms and it's gotten to be a complicated thing that I used to just go in there and just grab the placenta, like the hurdles that we have to go through for this, but we can't go through more hurdles to actually give somebody intentional care and make sure that doulas are being respected as a part of the care team without being a medical professional. Next slide. You can look at the pretty pictures. I'm not gonna go down it. It's just one of the two or three things that we do as far as spiritual care. Spiritual care is very important, and that blessing way ceremony literally is us blessing the womb and the portal that the baby does come through. Some people get it, some people don't, but those are the things that are intentional to culture. That is a big part of the full holistic spectrum care of a woman. The community, this is one thing that I just wanted to point out. And as I'm talking, you can go to the next slide. But these pictures are us helping them put their kids into groups or into things that they could do so they don't feel outcasted by a new baby. I bring women together for photos. This was a breastfeeding shot that we did on the left, the black and white. The box that you see me with the even flow, this is after the floods hit East Kentucky. I worked with 2 organizations. We were able to, because again, people were bringing food and all this other crazy stuff to East Kentucky when it flooded, but guess what, their cars with the car seats are stuck in the trees. And there are no car seats. There are no pack and plays. A lot of these people live in trailer homes. They don't have a room that's a nursery and there's beds. That pack and play is where the baby hangs out, sleeps, it gets changed in, and their playroom. So we were able to pack up and donate. we donated like 20 toddler car seats, and then we were able to donate like 10 packing plates. And I mean, in numbers, I wanted to do more. That's just all that they had at the time, but it helped a lot. It helped tremendously. Um, and there's more pictures with the village, us doing food cooking classes, us helping moms go grocery shopping on a budget if they're trying to work and receive food stamps. Again, nothing that is programmatic, nothing that is like grant, related. Nobody's funding this. This is literally like, oh, this is what you guys need to do. Let me call the village. Can we organize? Da 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 da, so we can get it going. Again, only person of me in this part of the state, only person at the time up until 10 years ago that was doing this type of work. Um, Wonderful folks at Food Chain, where we did food access. We were delivering 100 boxes, which I'm actually getting ready for, 100 boxes down to different parts of East Kentucky and parts of Lexington. And this wasn't just food boxes, it was food boxes, it was drinks, it was meats, it was seasonings, it was desserts, it was things to create a full meal. And then the moms would get in the Mama's Hub, and the moms who didn't know how to cook would bring them on to the screen, and then would cook with them and share their recipes. Like I said, not everybody had a full family. A lot of people didn't have the experience to learn how to properly cook and feed their family. So in slide, the future, which is now the present, I've created a full spectrum doula training. It is called the Floating Lotus. Holistic full spectrum training and certification. When you're done with me, you're certified, and you begin to shadow with myself or two of the senior doulas who I trained the past 2 years. We have our own training hub. If anybody wants to be trained, you're more than welcome to come see me. These pictures are in it. And like I said at the beginning, my issue is that every training that I was seen and went to, it was a whole lot of non-black bellies, non-black nipples, non-black vaginas. And I'm like, that's not what we look like, I'm laughing because it's like, it's not a one size fits all. And these doulas who came to me, or women who wanted to be doulas, they wanted to see themselves in the training and the stories, like I just have been saying here in this speaking engagement, like related to me, because I need to know how to really hit home when I'm talking to these people. 'Cause right now I feel like I'm reading a book. And so I created the training. It is trademarked, it is registered, and it is now working to be one of the cultural training doula certifications for the state. I'm working really hard through policy to have that. And I'm really excited about it. I have about 12 students underneath me. One of my students is now a midwife, and I am a student midwife due to graduate in 2026. And when I first started, there were no Black midwives. Now there are 2 going on 3. When I first started, there were no Black doulas on my part of the state, and I've now graduated out of those 12, 6 of them that are actively building their own businesses. And through that training, that's what I'm implicating. I don't want to be a staffing agency for you. I am being a backbone, a motherboard to teach you how to get your NPI, teach you how to get your business license, get your LLC established, build your web page, do all those things. So we are all standing on our own 2 legs, and finding our own niches around how we want to doula. I am a grandmother, I am a mother, and I'm a doula as such. Now we got aunties and sisters and friends of the community that are finding their own ways to provide and support care. So, yep, that's it. Thank you all for listening. I appreciate it.
Thank you, Tiffany, for all the wonderful work that you do for driving home some key points. Who's telling this story? Driving home the fact of we need, with regards to healthcare. And you said something about, the hospitals, basically, they can't come out the box. And they can't be the village that we need to be all the time. And with that being said, this is a nice segment over to Cadeska Bray, who will speak to you all from, I believe a village standpoint, and bring in, a cultural lens. And so, Cadest, I'd like to turn it over to you now.
Thanks so much, Bishop. And thanks, Yasmin, and every other speaker here, to emphasize the need of like postpartum care, especially, as well as, really looking at pregnancy, not like a issue of medical, right? But more so a full experience that women go through. So my name is Kadath, and I am the Communications and Campaigns Manager at the Black Appalachian Coalition. And I am going to try to talk to you all about my cultural experience and to kind of shift how we see birthing as an experience rather than a medical issue. I'm a proud African diaspora member and a proud immigrant from Ethiopia. I moved here to the US in 2010. And so as of a little bit of fact about Ethiopia, as of 2020, 70% of all births occur outside of the healthcare system in Ethiopia, and birth and birthing traditions are seen as not really a medical issue, but more so like a woman's issue and a woman's cultural tradition. So with that, I was kind of having a conversation with my mom and preparing to talk to you all today. And she was telling me some things that kind of resonate with some of the cultures that we already have in the US, but also back home, like what she would call a tasting day, for lack of a better term, which is like I would say the baby shower, right? A celebration before the birth, where the mother's to be with their friends and eat, dance together, gifts exchanged. But during the labor back home, family and friends kind of have a bunch of traditions like roasting coffee, burning incense, and sage, and a bunch of other herbs to ritually support the mother to be and get her in a relaxed, comfortable mode. And men are not surprisingly present during labor. And so in the rural areas, which a lot of the Ethiopian population live in rural areas, about 85% of the population lives in rural areas. There are midwives, and these are not, so I know doulas and there's midwifery is by the US standards. Midwives are more like nurse practitioners, and doulas are like the extra community hand that support that a lot of women need. However, I'm going to be using midwives because of the fact that these women perform as nurses and they are there from pre-birth care to postpartum care. And so, like I mentioned earlier, with 70% of the births, including my birth and my siblings' birth, being occurred at home with family and other women present, a lot of the midwife traditions and practices have been passed down from village to village, and they look different based on your different ethnic background. However, there is similarity in a way that it is a care supported by a village of women that you have known almost all your life, and they are taught these practices so that they're are there to assist you, whether it be for emotional assistance, to actually help you bear your placenta, because you don't traditionally throw that away. You keep it and bury it close to your home where the child will grow up. So there was another person who does that in a spiritual sense, as well as someone who actively assists you in a medical sense, looks at your breathing rate and things like that. And that also gives you breathing exercises. So that being said, in my country and in my tradition, birthing is seen as a communal experience rather than a medical one. And in that side, it has its own really great beneficial to mothers to be with. Even though Ethiopia is a global South nation, still struggling with access to healthcare, our birthing mortality rates have gone down in great amounts in the past decades because of the connection of midwifery and the healthcare system, because a lot of women already experience that care outside of the healthcare system. And on top of that, I also wanted to share with you all today, there's a connection in how a lot of the conversation that Dr. DeMarco mentioned earlier about your social determinants of health and where you live and access to clean air, clean water significantly impacts childhood mortality rate and the care that you receive during postpartum. And that cannot be more true in Ethiopia with climate change exacerbating access to clean water and clean air. A lot of the postpartum care for women are becoming harder with water, clean water especially becoming less available in rural areas. And so that being said, I see a lot of connection between the experiences of Black women in rural Kentucky and, Black women back in Ethiopian counties as well, in the way that the access to hospitals and access to a lot of great postpartum care causes great loss in pregnancy and childcare. And I think this is where we open the floor, correct me if I'm wrong, Bishop, for you all to ask questions, but also share any personal stories like mine that you have about birth, childbirth, or pregnancy.
So we had just one question in the chat, and I believe that if Tiffany just wants to answer it in the chat or send her a slide, someone just asked, how are you defining Lotus Care, I believe it is, or Lotus Birth. And I believe she mentioned earlier it was mind, body, and soul. It was a holistic approach. If there's anyone who has a question, you can raise your hand. We have a few minutes, and then we want to do some closing.
I was gonna say,
Go ahead, Tiffany.
the placenta and the baby stays attached to the placenta through the cord into the and we wrap it up, we put herbs in it and everything like that, and they will not let you do that in hospital. You can only do it in a home birth.
Thank you for that. I want to just say thank you to our esteemed presenters. And one of the things that Cadet brings home, is the fact of climate and environment. And I also believe Yasmin brought that home, and Tiffany and Patty, and I want to say, just being a mother who has given birth to 3 premature children, 1 pound 9 ounce, 1 pound 10 ounce, and 1 pound 15 ounces, is that it was due to, my environment. It was due to what I did not have access to. It was due to the fact that I experienced medical racism, that, certain people, someone mentioned the bedside manner. I believe it was Yasmin. There was no bedside manner, for me. And these things are realities. This is not to pretty much speak down of the healthcare, but we have to just look at the fact that some things are realities for certain, races of people. And like she said, it's not about race, it's racism. And I want us to understand that racism is, even though Black people are disproportionately impacted by it, the impacts of racism spreads across our cities, our communities. And that looks like a lack of access to healthcare. That looks like hospitals closing down. That looks like, petrochemical companies in our backyard. It looks like just, food deserts and food swamps. All of those things that we should have access to have a healthy way of living, we don't. And when people have to go grocery shopping at the Dollar Tree or the Dollar General or the Big Lot, you're not getting access to the nutritious things that you need. You're getting access to things that would help, hurt you even more. And it's unfortunate, that we have to live in a place and in a time where we have to not only have substandard care, but we have to have a way of providing for our families in a substandard way. Again, I just want to say thank you. This was really, really, really powerful. And as we conclude today's Healthy Mothers and Children in a Healthy World webinar, we want to extend our heartfelt thanks to each of you joining this vital conversation, and to our esteemed speakers, Dr. Patricia DeMarco, Yasmin Bennett Kelly, Tiffany Belfield El-Amin, Cadet Bray, and for their valuable insights and powerful stories. One of the things that, Tiffany said is, who's telling the story? What part of the narrative is missing? And I believe today we have learned, that we have to tell our stories, that it has to be by us, for us, that we are the ones that, when it comes to us, we are the experts. And I'm reminded of a quote by Dr. Martin Luther King, where he said, "We are now faced with the fact that tomorrow is today. We are confronted with the fierce urgency of now. In this unfolding conundrum of life and history, there is such a thing as being too late. There is no time for apathy or complacency. This is a time for vigorous and positive action. Today, I want to celebrate the fact that we have taken vigorous and positive action by bringing attention to the inequities affecting mothers and children in frontline communities, the essential role of midwives and doulas, and the pressing need to give every pregnant mother and child a healthy start. This work is about more than addressing disparities. It's about creating a foundation for dignity, birth justice, and health equity for today and future generations. This moment is a call to action. Each of us has the power to drive change, not only through advocacy, but also by using our voices in our communities and at the polls. Voting is one of the strongest ways to make an impact. With the election approaching, now is the time to support policies that prioritize health, equity, and justice for all. Stand with us by staying engaged, amplifying these critical issues, and following each and one of the speakers, following Black on their social media platforms, by going to their websites, listening to podcasts. You are a voice today. And like Martin Luther King said, we are faced with the fact that tomorrow is today. We don't have any more time to be too late. We don't have time to sit back and stage our city and sitting in the house talking about things, sitting in the car talking about things, sitting in the restaurant talking about things. It is time for us to take a stand and to get up and to remember that our vote is not just for a person who's a president. Our vote is for the dignity, the lives, the health, the viability, the economy, and the families of today and tomorrow and those to come. So I want to thank you today for being a part of this movement. I encourage you to let's continue working together to create a healthier, more just world for all mothers, children, and communities. Not only is the birth dying from the ability to give, the earth dying from the ability to give birth. We not only want to address that, but we also want to address the fact that we don't want any more mothers or babies dying from the ability to have access to the care, to the nurturing, and to the things that they need. So today is a day that you get to take a stance. You get to cry out and you get to call out. And we get to say collectively and individually, enough is enough. We want what is ours, and we have the right to live. We have the right to have a life that is thriving. We have a right to move from scarcity to deep supply. We have a right to look at one another and say, you deserve your right to health care, your right to your humanity, your right to live, your right to breathe, your right to eat, your right to be safe, your right to hope, and your right to think of your future story and tell it in a way that helps and heals each one of us from the traumas that we have been associated with, that we have experienced. Today is the day we get to reframe the story through our right to be just what we need to be with one another and for one another. Thank you all again for joining us. And remember, go out and vote. Remember, I'm not telling you who to vote for, but I am encouraging, use the power of your voice. And it is a collective voice, and it is time for the change that we need. Wishing you all a wonderful, rosy-filled day, and remember to smile. I heard it was contagious. Be like water and just flow into somebody's life and just laugh until you can't laugh anymore. We have enough problems already. So have that gut joy and that gut laugh and be beautifully you. Thank you again, and have a wonderful, wonderful day. Bye, everybody.
Bye, thank you. Have a great week, everyone.